Sometimes no matter how hard we work out or how many wrinkle firming creams we use, there's some things on our body that are too stubborn to take care of without drastic measures. But here's the good news. Getting rid of what you hate the most doesn't always have to involve surgery. Here to talk with us about some ways to reclaim our beach body before summer begins is Milan Shah from Beautologie. Thank you for joining us here today.
Thanks for having me today.
Well, what are some of the most common things people come to you about that they're not happy with?
Well, at Beautologie, we do offer the surgical realm of treatments and the non-surgical realm. And what I focus on is the non-surgical realm. And getting ready for the summer is a big, big thing on everybody's mind.
Right.
It all kind of trails from also those spring weddings as well that people are preparing for. And not always is surgery going to be the most opportune thing to go after. So non-surgical aesthetics are very, very common. Some of the things that patients really want to target are maybe reducing a few inches around the waist, around the hips, maybe around the thighs as well. And surgery, although as minimally invasive as it can be, still requires some downtime, a little bit of healing, maybe some small scars. Well, one of the biggest things we have available now, one of the most, the buzz as it is our venous freeze laser. What the venous freeze laser is, it's technology that uses two different energy sources. One is radio frequency, kind of like radio waves that we use here on a daily basis, and magnetic pulses. And by using these two different types of energy, we're actually able to shrink fat cells down and tighten skin.
Tighten skin, because that's key. I had a baby about a year and some time ago, and I'm still working on getting the pounds off, but there's still this lovely thing that hangs that I fear may not ever go away.
Right, and so, for someone like you, where it is post-pregnancy and it's just, a few little tiny, centimeters or, an inch or two that you're looking to firm up, the venous freeze is a wonderful, wonderful treatment. The nice thing is there's no downtime. It's very comfortable. Our patients are there for about 30 to 40 minutes once a week, for a few treatments.
Right.
And we're able to give patients back what they once had without undergoing the knife.
That is amazing. I mean, because I think that's what's hardest for most women is that, we work so hard and then, of course, having the baby is the most wonderful thing ever, but it is. Sometimes you just can't get it back. We're looking at some pictures right now of this woman's face. Let's talk lasers. There's a lot of them. What do they do? What do they treat?
Absolutely. So these patients that we're seeing right now had our laser peel treatment, our what we call our light laser or erbium laser peel treatment. And what this laser does, it resurfaces skin. It takes off that top layer, the epidermal layer of skin. And with that, we're going after things like fine lines, wrinkles, pores, acne scarring in just a few short days. The nice thing about the light laser peels, unlike the traditional deep CO2 lasers that you may know about, it is something where you could do it on a Friday. By Tuesday, Wednesday of the next week at the very latest, you're back to your regular routine, and we're able to achieve results just like that. The last gal over there had something called a liquid facelift, and what a liquid facelift is it's actually not a laser procedure, it's an injectable treatment where we're using a combination of facial fillers, a little bit of maybe Botox or Dysport, which are wrinkle relaxers, to give the patients their volume back. As we age, of course, our cheeks start to go down, our jowls start to develop, our eyebrows go a little lower. Well, we could target a lot of that with just injectable treatments. And again, little downtime. A couple days after the treatment, patients are right back to their regular activity, if not sooner, and they're putting off that major surgical facelift procedure.
Oh, that's amazing. All right, well, just in general with women, I mean, there is a lot of concern about feeling like, I don't want to inject anything in my face. I like to be au naturel. Have you started to see some of that stigma lifting with women these days?
Absolutely. The thing about our society today is we're living well into our 70s, 80s, 90s, and we're working well into our 60s, 70s, and even beyond. Sometimes the outside doesn't kind of keep up with the inside. Things like Botox Cosmetic, Dysport, our facial fillers, they've now been around for many, many years. Lots of research done behind all these products, and they're very, very safe products. our goal with these products are to give patients back something they've had, not go overboard.
Right.
Give them a nice natural look, something to balance their outside appearance with the way they feel on the inside. And so, yes, it's actually becoming very, very common. It's something where, you know, patients are going to the gym, exercising, keeping nice and fit,
Right.
and also taking care of their skin with some of these injectable treatments.
Great. Thank you so much for being with us here today. For more information, you can go to Beautologie.com, where you will get all the information you need. Thank you again.
Thank you
This
so
was
much for
very
having me.
insightful.